Later.
Before sharing a needle, a lot goes through my mind. If they have Hep C or not, if they're truthful to me and tell me that they have it or they don't. Getting that high is more overwhelming than thinking about it could be a dirty needle.
The acute hepatitis C that we're seeing today is almost exclusively IV drug related.
When it comes to somebody who's infected with hepatitis C, they are the most vulnerable. They're the ones that are most disenfranchised. In the vast majority of cases, these patients are not receiving treatments.
This disease will kill you. If alcoholism and addiction doesn't kill you, Hep C could kill you. I want other people to be able to go through treatment, to at least give a chance at having the treatment. Anybody in this world, a human being, should be offered a chance to live.
This is a kind of a family town. You know, I was raised in church. Church is a big thing around here, Bible Belt. I had a great childhood. I dated a girl throughout high school. I cared for her deeply. And her leaving, really, looking back, impacted my drug use severely. I found out, you know, by using, it took the pain away. That alcohol didn't do. Yeah. When I was in high school, there was no one, this is 2004, there was no one that I knew of that was using. Throughout the years, I have seen where it is very, people, you know, they're using in schools, you know, and shooting dope at a very young age. Hepatitis is ridiculous around this place. I didn't know what it was. I was very ignorant about it, but I contracted it very, very early in my drug use. I'd say within a year. Now that I wasn't diagnosed for another 3, but I probably had it from the gate. Yeah. Within just a few months, you are sluggish. You have very lack of energy. Stabbing pain that I have in my liver, swelling of the liver, you know. I have to push myself to want to get up and do anything. I'm 31 years old and I feel and act like I'm 60. The spreading of it is very much because of lack of information people have. When I was young, there was only a handful of people that I knew had it. Now, there's a handful of people that I know don't have it. Yeah, you got me. See what I do like that when I lose.
Where's the rigs? Amber.
Right here. Anthony, stop.
I'm sick. I don't feel good. I just hit somebody.
Well, that's not my fault.
I've been doing heroin and opiates for 10 years. First time I did it, I was just trying to escape my problems at the time, and that's why I tried it the first time, and ever since then, I've been hooked. As long as I do one good one a day, then I'm fine for that rest of that day. But then in the middle of the night, I'll wake up. You just won't go back to sleep until you go and get something.
We've been together for a year and a half. He told me when we got together that he had been tested for Hep, and that he was clean. I knew I was clean, but yeah, I have shared needles with him. Not wanting to, just because, you know, I've had to.
I have shared with other people, and just because I was not able to get new ones or clean ones or anything else, the price of someone having a bag of rigs was gold. I mean, I've seen 10 of them go for $50. We've had to use needles that were crooked and half bent and could barely get it in your skin because there's little hooks on it. Like, it's been really bad sometimes.
He actually broke the needle off in his arm.
I probably lost in this floor. It looked like somebody just a murder scene just happened. Everybody that's in my drug contact that uses drugs or does drugs, they all have Hep C. Last time I got checked last year on my birthday, or well, April 16th of this year, I didn't have it. But the doctor told me it's inevitable. And knowing that I do not want that, I can't stop. So, I mean, it's just...
It does make me fearful to share. I'm fearful of sharing with my boyfriend. You know, I'm fearful of sharing with myself. Reusing my needles every day. So all I can do is go down to the health department whenever I have a ride to get new needles.
So Huntington is a hotspot for hepatitis C. And it is a good question as to whether or not we're seeing more of it or we're just detecting more of it. So somebody's now infected with hepatitis C, what's actually going on in their body. Yet at first glance, without any questions, nothing. I mean, they don't even realize they're infected. But you start asking some questions. What's your fatigue level? How's your sleep? How's your thought processes? Do you have any abdominal discomfort? And they'll start going, well, you know, I don't really feel that well. Hepatitis C is a virus that is infecting and produced in the liver, but it can bind to any number of different cell lines. The risk of transmission is really well defined. It's not like you're going to go to a restaurant and come up with hepatitis C. There really has to be that blood-to-blood transmission, either through injectable drug use, it doesn't have to be intravenous, just injectable, or through snorting. So in Huntington and tri-state area, we are seeing the influence of heroin.
There has been an increase in hepatitis C diagnosis. We see it, we do testing here, and we see it here in the health department. And that is attributed to needle sharing.
Which is one of the reasons we're very passionate that we need to start something to stop that spread of hepatitis C.
Okay, do you need more sharps? Me and you are going to get about 30 new people. So.
Wednesdays is our needle exchange program, so we are serving most of the opiate users here in the county.
Number 9. All right, so this is the first time you're coming to our program?
Yes.
Okay, I'm Chris, one of the nurses.
Okay.
All right, so I'm just going to look over your form here quickly.
Okay.
So you first started using drugs when you were 16. How long have you been injecting?
I've only been injecting for about maybe 2.5, 3 years.
Okay. And you've never been tested for hepatitis or HIV?
No.
Okay. So I really encourage you to test. You should test.
I'd like to.
Okay.
So this is just a little sample of all the supplies that we give. If you have any friends that are here, you've probably already seen all these. You know not to share needles to prevent infections and spread of diseases. But also, there's other things that Hep C can live in. So it can live 21 days in a bottle of water, 14 days on your surfaces, like the spoons, tourniquets, right? 24 hours in filters. So we don't want you to share anything with anybody. So we're going to give you a supply so you can inject, as clean as possible, okay?
Wow, I didn't know that.
Yeah. Give you a little tourniquet too, because we want you to rotate your sites, if you keep hitting the same vein all the time. We've had people that come to the clinic that say, I've never shared a needle in my life, I'm Hep C positive. And when we show them the CDC study and they say, oh, I have shared water, or I've used the same cooking spoon with someone else. So then it's kind of an aha moment. All right, so let me get your supply. So you do want all long needles, right?
Yes, please.
We aren't only just giving needles, we're teaching them to clean the sites to reduce bacteria getting into their system so they can stay free of Hep C, or if they have Hep C, so they're not passing it on to anyone else.
Program is awesome. They give you everything. They give you needles, they give you the towel, everything sterile. I'm being checked for hepatitis C and A and B and everything else. Because I know I have had a couple of friends die of liver disease from from having Hep C. Just had one die maybe 2 weeks ago. They're wanting me here for some reason. They sent me a certified letter, so yes, I'm pretty scared about it. I come in here for my test results today also, and I got them, and I do have Hep C, and I'm going to pursue it to go get a doctor and pursue what I do from here. I'm going to treat it. I'm going for treatment as soon as I leave here.
The syringe exchange in Huntington is here at exactly the right time to do exactly the thing that it's designed to do, and that is prevent a great many cases of hepatitis C. When we decided to start the syringe exchange, it was very controversial. When we first opened the door, 15 people came, and they stared at the floor. They wouldn't even make eye contact with us, let alone talk to us. They were afraid this was going to be a sting, that they were going to get arrested when they left. And they had a great deal of courage to come here. We saw roughly 2,000 individuals in 1 year's time. We need to reach 4,000 more, and we just don't have the money to do that right now.
I think people think that we're enabling and that we take all these tax dollars. We work with the grant and donations. And Narcan's all donated. So I think when you hear arguments of people saying, let them die, don't use my tax dollars, that's just horrible. And even people that I've used for a long time that go to work every day, raise families, function just like people who aren't using, should have access to the supplies that they need. I mean, it's illegal to buy needles in the state without a prescription.
We've applied for about $1 million in additional grants so that we could increase our program to the size it needs to be for the problem that we've identified. And so far we've had nothing for ongoing funding. We have a great opportunity and we need to seize it.
Treatment of hepatitis C has evolved over the last, we're moving now to 30 years. Originally, it was a daily shot of interferon. Many side effects, miserable therapy. And we were talking on the order of 48 to 72 weeks of therapy. Hair loss, depression, abnormal blood counts, just very difficult. And then in 2014, the beginning of 2014, the first of the newer generations of protease inhibitors were introduced. We're looking at 12 weeks of therapy in most cases, with a success rate of at least 95%. When I say success, I mean cure. Treatment cost in this particular situation is incredibly high. We're looking at somewhere in the range of $50,000 to over $100,000, depending on who you talk to. Unfortunately, I think there has been a slide towards, well, I'm going to use the word, profiteering. It's very, very frustrating.
We have a wonderful new drug to cure hepatitis C, which otherwise kills.
Right.
Okay.
It costs $1 a pill to make. The company that bought the patent, it didn't make the drug, it bought the patent, charges $1,000 for that pill.
What's the company?
The company is Gilead Science.
Using Gilead's own documents, the evidence shows that the company pursued a calculated scheme for pricing and marketing its hepatitis C drug based on one goal: maximizing revenue regardless of the human consequences.
My name is Greg Alton. I'm Executive Vice President of Commercial and Access Operations, as well as policy work and medical affairs work at Gilead. For the three drugs we have, so Sovaldi has a list price of $84,000, but you need about another $10,000 worth of interferon on top of that. With Harvoni, it's $95,000, and with that we get about a 95% cure rate. And with Epclusa, the list price is roughly $75,000. We take a global approach, and we do tiered pricing globally. And what we do is we look at the wealthiest countries in the world will pay what we consider to be our full commercial price. Now the US is unique because we have multiple prices in the US. We have our private price, we have our Medicare price, which is sort of in between private and public. We have our Medicaid price, we have our VA price. When we're having these conversations about access to medicine and people who are underinsured or uninsured, who don't have coverage within their plans, whether it's Medicaid or otherwise, why don't you just lower the price? The answer is we have lowered the price. We've lowered the price significantly. It's really now time for the plans to actually step forward and do what they're designed to do what they are legally required to do. The Medicaid programs are legally required to cover hepatitis C and are resisting this. You know, if you think about, take West Virginia as an example, yes, they have a very high burden of hepatitis C. It's something they haven't been spending money on traditionally. So this would be to do something fundamental for hepatitis C will require additional budget at whatever price we come out with.
Now, well, I've had a discussion with the director of Medicaid fairly recently. Now, Medicaid is very well aware of all of the medical marvels that the drug is capable of. They know the cure rate, then they know the dollar amount, and the dollar amount is just too high. This is a state that's economically in a depression. Our economy was gutted from the coal industry. We're choosing between medicine and food, and we're choosing food right now. We know that we want to pay for the medicine, but we can't. I can pretty well say that if that drug didn't cost that much, more people would be getting treated.
If people are sick and they've got one problem, and that problem is hepatitis C, I do all the workup and then say, well, we'll see if your insurance company will actually provide the medication. I am building up a practice of patients with a curable disease that I'm not allowed to cure. It's incredibly frustrating for everybody involved.
This is my son, Charlie E. Smith IV. We call him Chucky. And this is my son, Chase Anthony Smith. And these are my two boys, and this is my friend, Zach. Zach is now more or less part of my family. When I found out I had Hep C, it floored me. I thought, man, I'm gonna get liver disease, I'm gonna end up dying, this and that. But when you talk to the counselors and you talk to the people at the clinics and stuff, they'll tell you, you know, it's not as bad as it used to be. It used to be a death sentence. Now they got treatments for it. We haven't shared needles since we've been going to the program, because we don't have to now. But before the program, yes, we did share needles. And I hate that we did that, but we did. And I mean, it's, you know, it's rare, but it only takes one time. Hopefully, with any luck, they'll get tested and not have Hep C. I pray to God that they don't, but I don't think that's going to happen.
There is a good possibility that I got hepatitis by sharing with my father.
It's scary for us to go down there and get tested, but I think it's the best thing for us to do. All the things you told me, that how it's passed on, probably a really good possibility.
I know. I couldn't believe the water, how it can live in water up to so many days.
Yeah.
That and the friends that we've used that after, we don't know if
I've never used a needle after somebody.
Well, I have a couple of my friends. I mean, I'm not going to sit here and lie and say that I haven't, because I have. I don't know. Whatever. I'm done talking about it.
If it is what it is, I mean, I'd rather know than not know, I guess.
Yeah.
Any relationship I get in, I try to be honest with anybody I'm with. Immediately upon meeting someone, I tell them I have hepatitis C, which is not the greatest thing you can say to somebody. The type of hepatitis that I have is genotype 2, one of the hardest strains that you can have, and it's very aggressive. I don't even know the extent of damage. I'm just, I'm 30 years old. Who knows what 10 more years would bring. But now with the new, the pill form they've got out, it's way more successful with all the genotypes. But the main reason I haven't tried that, Allie, is because here I am knowing in my mind that I'm not done, and I've tried to quit. I've been to several rehabs. I've tried to quit, done methadone, done Suboxone programs, hasn't worked. So I didn't want to get the treatment and then get it again. But yeah, to tell somebody young, I mean, it's not worth it. It is, I've destroyed my life. Yeah. From my experience, the best people you meet are people that have gotten clean. There's something about people that get clean that want to help other people.
When I got clean and sober, I was serious about my life and getting myself back together spiritually, mentally, physically. I went to the best infectious disease doctor in Huntington, which is Dr. Thomas Rushton.
Sally Johnson is one who was referred to me, I think through some of her contacts. And so she came to my clinic, and we were trying to figure out the best therapy for her and so on. And we were actually able to get her one of the newer therapeutic interventions.
I wasn't going to be able to get it through Medicaid. They weren't going to pay for it. I remember his nurse, Angela, said, it's okay, just give us some time. I'm trying to work something out here. And they did. And I was given a chance to cure my Hep C.
And at first it didn't look like it was going to work. We were kind of disappointed, obviously, but then her immune system, her body kicked in, and looks like we were successful with therapy.
But 3 months later, I had the testing done, the lab work. Angela called me, and I knew it was something good by the tone of her voice, and she said, your lab work came back. And I said, oh, it did. She said, Sally, it says no evidence of Hep C, no evidence of C. And I just felt this, it was like a release. I was this close to death, and in addiction, I didn't really care. And when I got clean and sober, I cared.
Hey, did you call her Miss Foster? You are so freaking mean. How come you're not going to be in Hep C?
I gotta work security tonight.
Oh, gosh, something more important.
Y'all going to Hep C, right?
Yes, sir.
Actually, y'all's escort is right here.
Oh,
We're over this
we
way.
got an escort, man. We are, look, we've arrived.
Y'all have a good meeting.
I go to the needle exchange at the Cabell County Health Department on Wednesdays. I go there in a recovery coach capacity. Now that I've gone through being in the addiction, contracting Hep C, being cured from Hep C, my responsibility as a sober member of the universe, my responsibility as a human being is to help those people who are going through what I've already gone through.
Most of us that are in addiction got hepatitis C. It's hard to come out and say I have it, because people do look at you differently and they go, well, I don't want to be around that guy. I might get it.
Right.
And they don't even know how you get it, but it's very hard to get. It's blood to blood. I know you've seen some friends of ours that have died from this disease, and it's not an easy way to go.
What do you all got to say about it? How do you feel about it? Is there fear associated with it?
I'm scared a little bit about it, I can't really see the effects of it, but I know that I have it. And, I got kids, young kids, and I would like to be there for them,
To find out that treatment, it's going to cost you outrageous sums of money. Like, your life could be saved. So my life's worth $100,000. That's insane.
The state Medicaid doesn't have that kind of money. But starting now, and you be persistent and just keep going at it, keep showing up for the doctor's appointments, sooner or later, because people are advocating for us so much, you will get the treatment. It's just, you can't give up. When AIDS first started, look how that movement's taken over.
And see, it started just like with Hep C, as far as the HIV is paying for medications. These people were not getting their medication paid for. It was thousands and thousands of dollars. And so, again, everybody joined together and said, this isn't right. You're excluding us because of this disease, this virus. That's not right. Why are you making a medication that the population that is affected by Hep C doesn't have the money to pay for the drug? Now, what sense does that make? It makes 0 sense, and it's not going to change unless we force it.
We're going to get tested to see if we have Hep C or anything else. Kind of nervous, but definitely need to know. So hope everything goes good.
Anthony Kelly. Hi there.
Hi.
How are you?
Good.
Let's go back to number 4. All right, and let me get your date of birth.
4/16/84.
This way just a little bit. Can you make big copies for me?
The one I use.
You prefer me to use the other one?
It don't matter. It'd probably be easier if you can't find one.
That'll stick.
Just mail the results to us.
I think it's the reason they took your address and everything up front.
Okay.
I wish I would have had the help earlier on. I mean, it would definitely change things, but it's you still wanting to get high in the back of your mind more than thinking about who else has used the needle or what they might have. I would hope that I wouldn't. I would think about things more after learning all this, but you really don't know until the dope's right in front of you and you're wanting to get high.
I'm not gonna be a junkie and using needles and doing heroin for the rest of my life. If I don't OD or die before we can get into a program, we're gonna get into a program and then change our lives back to the way it used to be. Me having fucking landscaping jobs, putting up private fences, and I mean, I had cars, I had a nice home and everything.
I've been doing drugs so long that I can't remember what it's like to be normal. Waking up every day and having to worry about how you're going to get feeling good. If you have the money, what if you don't? What do I do that day? I don't remember what it's like to be a normal person and not have to wake up and be dependent on a drug. I've been doing drugs that long.
People to be able to go through treatment, to be offered the treatment, to at least give a chance at having the treatment. You know, believe me, it's not easy getting sober. It's an accomplishment, regardless of what anybody else in the public thinks that's never been in addiction or known anybody in addiction. It's not easy getting clean and sober. And the disease is right here in your thinking.
Was hepatitis C, substance use, because they go hand in hand, is an epidemic? It is. But I think also fundamentally we have a mental health issue. We have people who are despondent. Their souls are damaged here. I have not yet met an addict that woke up one day and said, today I want to be addicted to heroin. There's always a story, there's always a process, there's always a reason. Hepatitis C is important, but we need to embrace our humanity.
This field was the first place I ever hit a home run.
Really?
Yeah. You didn't play softball here?
I never played softball.
Never played baseball or anything?
Nope. I was a cheerleader. That's all we need, a little boy. Watch him play baseball.
Come on, man. I'm sorry with that bullshit.
Huh?
No. Not till we're clean.
if I could help anybody with saying something, I would just tell them that, you know, it'll get better. You can't fix anything right now, you know. Building something beautiful takes time. Definitely think things through. Don't get to the point where, you know, all hope's lost. You can live 40 days without food, 6 without water, but only seconds without hope.